Here begins Disc 2 in the deposition of Linda Carlson, 5:31 p.m. Back on the record.
Hi, Ms. Carlson. For the record, this is Mary Pat McGuire, and I'm just going to ask you a few follow-up questions, okay? And I apologize if this bounces around a little bit, but I just want to make sure that we have some things clearly on the record. Mr. Gaston was asking you a series of questions regarding Mr. Tolson's Triage by Sharon Beshy Craddock, RN. Was Ms. Craddock, the triage nurse, required by the standards of care to assess Mr. Tolson's popliteal pulse?
No.
Okay.
You always assess pulses distal to the injury.
Okay. So the requirement by the standard of care is that you assess distal pulses.
Correct. And if for some reason that pulse is not felt, then you need to move up.
Okay.
And then you would go up the leg.
All right. So as I understand it, the way you would go up the leg is you would do the dorsalis pedis pulse, which is the pedal pulse, correct?
Correct.
And then the next one up the leg, if you couldn't find a pedal pulse, would be the posterior tibial pulse.
Correct.
And then if you couldn't find either of those pulses,
Then you do a femoral.
then you would do a femoral.
Correct.
Okay.
But if you've got distal pulses in the feet, you've got to have a popliteal because it has to go through that artery.
Okay. You also, there was also some questions posed to you regarding Nurse Craddock's charting. She writes, and if you want to look at her triage sheet again here, let me know when you're there.
I'm there.
Okay. Do you see where she writes positive pedal pulses?
Yes.
Okay. And did you read Sharon Craddock's deposition testimony about how she performs triage and what her charting on Mr. Tolson shows that she did with respect to performing his triage assessment?
Yes, I did.
Okay. Is there a requirement under the standard of nursing care that Nurse Craddock document positive pedal pulses using the 1+ to 4+ scale?
No.
Okay. As a nurse, if someone records positive pedal pulses in an emergency room record, what, if anything, does that tell you about those pulses?
They're
Objection
normal.
calls for speculation.
Pardon me?
They're normal.
Okay. The fact that positive pedal pulses, plural, is written on this triage sheet by Nurse Craddock, what does that tell you about whether she evaluated both the left and the right foot for pulses?
That they're equal and bilateral.
In other words, bilateral,
Positive.
she checked both feet?
Yes.
Okay. How many pedal pulses, never mind, strike that. Did you review Ms. Craddock's deposition testimony where she discussed how she performed her triage-focused assessment on Mr. Tolson's left leg?
Yes, I did.
Okay. Did Ms. Craddock perform a neurovascular assessment on Mr. Tolson in triage?
Miss Craddock?
Yes.
No.
The triage nurse.
Oh. Yes, she did by checking their pulses.
Okay. And she also testified to putting her hand on his legs, correct?
Yes, you have to touch the patient to do a pedal pulse.
Okay. And she testified to assessing him for his temperature, correct?
Correct.
And she testified to asking him whether she could feel him touching her on both sides?
Oh, yes. Yes.
And she testified that she asked Mr. Tolson if he was having any numbness and tingling, correct?
Correct.
Okay. And she testified that she asked him if he was able to move his leg and foot, correct?
Correct.
And she documented here, unable to move left foot. Is that correct?
Correct.
All right. So according to Ms. Craddock's, the triage nurse's, deposition testimony, do you have an opinion whether or not she did a neurovascular assessment at triage?
Objection, go ahead.
She did do a neurovascular assessment.
Okay. And does the fact that she noted unable to move left foot and positive pedal pulses, that she recorded that, wrote that in the chart, tell you anything as to whether or not she performed her neurovascular assessment?
She did do a neurovascular assessment because you can't do a pedal pulse without feeling the skin, talking to the patient, doing and assessing whether or not he's got sensation in both legs. You're looking for swelling, and you're doing both legs. So if you're going to touch for the pulse, you have to press down.
I don't think I asked my question well. Let me try it again.
Okay.
Okay. Did you see in Ms. Craddock's testimony where she testified that she too, in triage, charts by exception?
Yes.
Okay. Mr. Gaston asked you a question earlier in your deposition today to ask you whether or not there was any record anywhere on this triage sheet that indicated that Ms. Craddock had performed a neurovascular assessment.
Correct.
Under the charting by exception principles, am I correct that her charting here, that he's unable to move his left foot and positive pedal pulses, is in fact her charting that she performed a neurovascular assessment and the only abnormality was an inability to move left foot?
Correct.
Okay. Now, you said, you noted in your testimony earlier today that Nurse Craddock recorded positive deformity on her triage sheet. Do you see that?
Yes, I do.
Did the standard of care require the triage nurse to further record the nature or character of the deformity?
Not at this, no. Mm-mm.
Okay. Okay. Now let's go a little bit with respect to Caroline Stell.
Okay.
Caroline Stell is the nurse, one of the nurses in urgent care and the nurse who performed Mr. Tolson's initial assessment. Okay. What did the standard of care require Nurse Stell to palpate Mr. Tolson's popliteal pulse?
Not if he had distal pulses.
Okay. And in her testimony, did you see where she testified that Mr. Tolson did indeed have distal pulses?
Yes, she did make that in her testimony.
Did you read Ms. Stell's detailed deposition testimony where she outlined with great specificity what she did when she did her initial assessment of Mr. Tolson and when she performed her focused assessment of his leg?
Yes.
Okay. Did her description of how she assessed and performed her initial assessment of Mr. Tolson comply with the standards of nursing care?
Yes.
You've been asked some questions about documenting by exception.
Yes.
If something, oh, never mind, I'll strike that. Am I correct that there was no requirement under the nursing standards of care for Nurse Stell to record the pulses as positive or to record them as +1 to +4 if there was no change in the pulses from triage.
Correct.
Now, Nurse Craddock, the triage nurse, triaged Mr. Tolson as an ESI 4. Is that correct?
Yes.
All right. And am I correct that triaging him as an ESI 4 complied with the nursing standards of care for performing triage, in your opinion?
Correct.
Okay. And it was also, is it also your opinion that Nurse Craddock complied with the standards of care for nursing and performing triage when she triaged Mr. Tolson to urgent care?
Yes.
Okay.
You have to remember triage's presentation.
In other words,
It's how the patient
assessment
presents.
Right. So the assessment at presentation is what the triage nurse uses based on her nursing assessment of the condition at triage going forward, correct?
Correct.
You don't do triage in retrospect.
No.
Okay. You don't, at the end of a patient's stay in an emergency room, then look backwards to decide what triage should be or should not be, correct?
Correct.
Okay. There was no requirement by the standards of care for any nurse to send Mr. Tolson to the main ED on December 3, 2009, correct?
Correct.
There was a very large number of questions that were presented to you regarding hypotheticals involving complaints of a cold foot or a hypothetical complaint that Mr. Tolson could not feel his foot. Do you remember those questions?
Yes.
And in several of those questions, you were asked whether a nurse should communicate those findings, if hypothetically they were there, to the doctor. Do you recall those questions generally? Yes. Okay. In any of those answers that you gave, am I right that you include the PA and the doctor in those answers? In other words, if something is, in some situation, if something is to be communicated to a doctor, it would suffice and meet the standard of care if it was communicated to the PA.
Correct.
Okay.
They're considered a higher level.
Okay. So whether it be reported, whether something be reported to a PA or whether something be reported to the MD makes no difference. It's just the fact that it be communicated to someone in the physician staff.
Correct.
Whether it be physician assistant or physician.
Correct.
Okay. And the reason that certain things should be communicated to the PA or to the MD is so that the PA or the MD is aware of that finding, whatever it is. Is that correct?
That's correct.
Okay. Did you read Corey Elaine Tolson's deposition testimony?
Yes, I did.
Okay.
She's the sister, right?
Correct.
Yeah.
Before I get there, let me ask you this. You read Kevin Tolson's affidavit, correct?
Yes, the one dated October?
Yes.
Yes. Yes.
I think it was Exhibit 3 to Nurse
Yeah, that was
Margison's
like
deposition.
2 weeks ago or something. Should be somewhere.
It was October of 2012, actually.
Oh, it was?
Yeah.
But I don't think I saw it till like a couple of weeks ago.
Well, that would,
Yeah.
you're with the rest of us then,
Oh,
because none of
okay.
us were ever presented
Okay.
with that affidavit either, but nonetheless,
It should be in there.
yeah, I'm having
Thin.
trouble putting my hands on it. In any event, did you see in Mr. Tolson's affidavit that here it is. Okay, it's October 19, 2012 is the date of the affidavit.
Okay.
Is that correct?
Yes.
All right. And I need you to hand it back to me for a second because I can't remember it verbatim. Am I correct that Mr. Tolson swears in this affidavit that he not only told the nurses or the nursing staff or the discharge nurse, that he informed the medical staff who was caring for him in the emergency room that his left foot was cold to the touch? And I think that's under paragraph 3.
And the question is, did he
Did
say?
he also say
says
that he
he
told the
reported it.
physicians?
Yeah.
Okay.
He reported it. He said he reported it.
And the medical staff in this, you would take to include both the PA and the MD? Is that your understanding of
Yes.
this? Okay. Now let's get to Miss Corey Elaine Tolson's deposition. You've read her testimony as
Yes.
well, correct? She's Mr. Tolson's sister, as I understand it.
Yes.
Okay. Did you see the testimony by Ms. Tolson, Miss Corey Elaine Tolson, that when she was in the room in urgent care visiting with her brother, there was a nurse who had just taken his vital signs. Do
Okay.
you remember seeing that?
Yes.
Okay. And that she said at that point, she recalls her brother telling this nurse that her foot was cold, his foot was cold, and the nurse was leaving the room at the time and said she would tell the doctor.
Correct. I
Do you
remember
recall that
reading
testimony?
Yes, I do remember reading that.
And do you recall that the next part of Miss Corey Elaine Tolson's testimony was that the nurse left the room, Miss Tolson remained in the room?
His mother, yes.
No, Miss Tolson,
Okay.
Corey Elaine was still in the room. The
Okay.
nurse left the room, and then a person who she believed was the doctor came into the room, introduced herself as the doctor, and performed a physical examination on Mr. Tolson.
I recall in her testimony that, yes, she was leaving to go out to the waiting room when a provider went in. A doctor, she described it as with a white coat.
Okay.
She
And
did not
do-
remain through the exam. But I
Right.
believe her mother was there and made comment about a doctor coming in and re-examining his leg.
Okay. That's exactly right. I'm sorry, I misquoted, and you're exactly right.
Yeah.
So Ms. Tolson was there for the nurse leaving and saying she was going to
Right.
report to a doctor. She's-
Right.
Do you recall that she testified that she didn't know one way or the other whether the nurse said anything to the doctor because she wasn't outside of the room at that time?
Yeah, I believe that she did say she didn't know one way or the other.
But that
But
she
who
does
informed her?
recall that the next person to enter the room was the doctor.
Correct.
Ms. Tolson then left the room, leaving her mother in the room, and her mother then testified that the doctor did an examination of Mr. Tolson's leg.
Yes, that's in the deposition from the mother.
Okay. Under that set of facts,
Mm-hmm.
accepting Ms. Corey Elaine Tolson's deposition testimony as accurate, and accepting Mrs. Marion Tolson, the mother's deposition testimony, as accurate,
Mm-hmm.
is there anything to suggest that even under that hypothetical where there was a complaint of a cold foot or a complaint that Mr. Tolson couldn't feel his foot, that that was not communicated to the PA or MD for reevaluation?
Objection. She has no idea what the nurse said to the doctor, and no nurse ever said that they conveyed any of those complaints to the doctor. So your hypothetical puts in facts that we know aren't true in this case because none of the nurses said they ever told the doctor that Mr. Tolson had a cold foot.
Do you remember my question?
Just repeat it again,
Sure.
please.
Okay.
Hypothetically.
Okay, so I want you to accept
Right.
Mr. Tolson's testimony and Ms. Corey
Okay.
Elaine testimony, and Tolson's testimony, and and the mother's testimony, Marion Tolson's testimony, is completely accurate.
Okay.
Okay? For purposes of this hypothetical. And that in this hypothetical, their testimony was that Mr. Tolson complained of a cold foot or that he couldn't feel his foot to the nurse, who then said, "I'll tell the doctor." She walked out of the room. Their testimony is that then a doctor came into the room, and their testimony, Mrs. Marion Tolson's testimony, is that this doctor then, that came into the room, then re-examined Mr. Tolson's leg and foot. Okay? Accepting all of that testimony as accurate and true, do you have an opinion that you hold to a reasonable degree of medical probability as to whether the doctor was aware of Mr. Tolson's leg and evaluated it at that time?
Objection, you're missing a big portion of the facts.
I believe he was aware.
Okay. And if the doctor and PA were female, Ms. Shaw and Dr. Prudence Jackson?
Those are the only two I know that did examine him according to the record
Okay,
in the
so
depositions.
they were the ones that examined him and came
Right.
into the...
And I'm sure if Mr. Tolson had a cold foot, he had to have told him that.
Okay.
I mean, if he's telling everybody, why wouldn't he tell them?
And certainly, they
Right.
know with the condition of his leg if they're doing a physical examination
Absolutely.
of him
Objection.
at that time. Is that correct?
Objection.
Correct.
It's
Okay.
cause for speculation as to what they know if they didn't examine his leg properly. That's why we're here.
Well, I don't have an issue at all with that. I'm not asking whether or not they examined his leg properly. I'm simply asking you if you even accept all of this hypothetical testimony that has been proposed to you by Mr. Gaston in this case. If you accept all of that as true, isn't it true that the physicians were aware of the condition of his leg because they came into the room and they examined him at that time?
Objection, calls for speculation again.
Yes.
Okay. Did you read Caroline Stell's deposition testimony where she testified that if a patient made a complaint like that to her, hypothetically, that she would report it, communicate it to the PA or the MD?
Yes.
And at discharge, am I correct that the PA, Ms. Shah, performed a neurovascular examination on Mr. Tolson after he was in the knee immobilizer at around the time of discharge?
That's what's documented
Okay.
in the chart.
So that's in the medical record,
That's in
correct?
the medical record.
And did she document the results of her neurovascular examination of Mr. Tolson at discharge in the medical record?
I believe. Post-split application and neurovascular assessment performed by me and intact,
Okay.
with a check mark and her initials.
Okay, so when it says that the neurovascular assessment was intact, what does that indicate to you as a nursing provider?
That she rechecked the patient's neurovascular status after application of the knee immobilizer.
And when it's intact, what does that mean?
It means he's got pulse, sensation, feeling.
Okay. In doing in other words, it's normal.
Correct.
Okay. So again, even under Mr. Gaston's hypothetical, where at discharge there was a complaint, hypothetically, of a cold foot, am I correct that Mr. Tolson, do you have an opinion as to whether Mr. Tolson had a neurovascular assessment by a member of the medical staff at around that time?
Yes.
Okay, and what is that opinion?
That it was his neurovascular status was intact
Okay, and that would be the Krupa Shaw?
from Dr. Shaw.
Okay. Do nurses, I'm going to ask you a couple questions about the scope of nursing practice.
Okay.
Do nurses make medical diagnoses?
No.
Is it within the scope of nursing practice in the emergency department to formulate or form in their mind a list of differential diagnoses? Is it within the scope of nursing practice to determine which types of testing, whether it be vascular testing like an arteriogram or orthopedic testing, is required by the patient or indicated for a patient?
No.
Is it within the scope of nursing practice to order such tests, like an arteriogram or an arterial duplex or a CT angio or an MRI?
No.
Is it within the scope of nursing practice to determine whether an orthopedic or vascular consultation is needed?
No.
Is it within the scope of nursing practice to order a consultation by orthopedics or vascular?
No.
Is it within the scope of nursing practice to reach the discharge diagnosis or impression of a patient in the ED?
No.
Is it within the scope of nursing practice to reach the disposition for a patient in an ED?
No.
You were asked to read your notes into the record. Do you have this again? I did have a question. In your notes, Ms. Carlson, you spoke about the medications that Mr. Tolson received and who administered them. I just want to take you to the record because I think that there's something that was misstated in the note, and I just want to make sure that the record is clear. So if you could go to the medication administration page in the record. Are you there?
Yes, I am.
Okay. The top one is the Dilaudid, 1 milligram. Do you
Correct.
see that? Okay.
Correct.
And it has Anita Weiss's initials and Caroline Stell's initials next
Correct.
to it? Okay. Do you recall reading Anita Weiss's testimony that she was the nurse who actually administered the Dilaudid
Yes.
to Mr. Tolson?
Yes, I do recall that, and I do recall in her deposition that she diluted it and gave it slowly over so many minutes.
Okay, and you recall her talking to Mr. Tolson during the administration, assessing him during that time?
Correct.
Okay. And am I correct that Caroline Stell testified that her signature there, her initials there, just indicates that she's co-signing on that medication because it's a narcotic?
Correct.
Okay. And then the Toradol underneath that is the next medication, and that has Caroline Stell's initials next to it. Is that correct?
Correct.
And do you recall Ms. Stell's testimony that she is the person who administered the Toradol?
Yes.
Okay. In your review of this, of the medications given to Mr. Tolson, and this is going to be kind of a broad question, so let me know if you don't understand it. Was there any breaches in the standard of care that you identified with respect to the administration or assessment of Mr. Tolson with respect to his pain medication, either the Dilaudid or the Toradol?
No.
Okay. I just want to make sure, because this is something that was addressed in Nurse Margison's deposition. I don't know that you'll be asked this at trial by Mr. Gaston, but I want to make sure you're not precluded from testifying to anything.
Okay.
Because you've certainly been designated as someone who would respond to the expert opinions by Nurse Margison at least. And Nurse Margison at least. Do you see at the bottom of this page where the discharge documentation is, the disposition documentation?
Yes.
Okay. there's a block here at the very bottom of the page. It says signatures, initials, signatures, initials. What is that?
That's because there's a lot of places have this. We have it when we were on paper. It's
What is it?
it's her signature and her initials.
Okay. Is it a
Verifying she documented in the record somewhere.
Okay. So as I understand it, this is sometimes referred to as a signature block.
Correct.
Okay. And a signature block is the place where a provider's initials are then identified with that provider's full name.
Correct.
Okay. And did you see Anita Weiss's deposition testimony where Mr. Gaston said, so your initials here are simply, and signature here on this page is simply a reflection of the fact that your initials appear in this chart? And she said yes.
Yes.
Okay. And do you recall Ms. Weiss testifying that she had nothing to do and was not involved in Mr. Tolson's discharge?
Yes.
Okay. And did you see Caroline Stell's deposition testimony where she testified that she was the nurse involved in his discharge?
Yes.
And did you see Caroline Stell's deposition testimony where she said that it was her signature, her initials rather, that was on the patient signature instruction page, indicating that she had given him his discharge instructions and that he had verbalized understanding of the instructions?
Yes.
Not Anita Weiss.
No, it was Carolyn Steele, and she said so in her deposition.
Okay,
And her name is spelled out
correct.
on the deposition, on the discharge note.
Okay. Mr. Gaston asked you some questions regarding Ms. Stell's documentation. And he was pointing you primarily to the page that's crossed out. Is there anything from Ms. Stell's documentation on other pages of the chart? And by that, I'm going to reference you to actually, Mr. Gaston, can I use your, I want to make sure I'm using the right numbers, page numbers.
It's
Yes,
exhibit.
thank you.
Uh-huh.
I got it. So you've already testified, Ms. Carlson, that the fact that Ms. Carlson put an X on the nursing assessment form, which is Deposition Exhibit 2, page number 6, that is documentation of the fact that she performed her initial assessment and that there was no change from the triage documentation.
Correct.
Okay, or the triage assessment. All right. Now I'm going to ask you to look at page 19 of that same exhibit.
Okay.
And I'm going to proffer that Nurse Stell has testified in deposition that her handwriting is at the top right column here where she puts writes pain and swelling, that's her handwriting.
Correct.
And that Nurse Stell also testified that this left ankle, tib, fib, knee, hip, femur x-ray is her handwriting.
Correct. I saw that in her deposition.
Okay. Is there anything about this documentation on page 19 by Nurse Stell that indicates to you whether or not she performed her initial assessment on Mr. Tolson?
You'd have to do an assessment in order to know what to appropriately enter for x-ray.
Okay.
And it's obviously that the patient continues to have pain and swelling. But obviously she's checked his ankle all the way up to the femur.
To the hip.
Or the hip. There you go. And she thought it was indicated.
Okay, and do you recall Ms. Stell's testimony on that point, where she said that she can't determine whether or not she should get x-rays and process until after she has performed an initial assessment?
Correct.
Okay.
Correct.
And so would you agree with me then, as I'm sure you will, that this
Yeah.
documentation here by Ms. Stell on page 19 of Exhibit 2 is further written documentation in the medical record that she did in fact perform an initial assessment on Mr. Tolson?
Yeah, that's pretty common. I mean, you have to assess every area that you're going to x-ray.
Ma'am, you're covering her face when you're holding it.
I'm sorry.
If I was taller.
I'm sorry. I'm trying to be helpful. Thank you for that. I believe, ma'am, that that's all my questions. Thank you very much.
Okay.
I just have a few.
Okay.
I'm going to hand you exhibit number 2, page 5.
Okay.
I think when Ms. McGuire was asking you reasons why you believe Nurse Craddock performed the neurovascular assessment is because she wrote on there that Mr. Tolson was unable to move his left foot. Would that be true?
No, it was because he has positive pedal pulses.
Okay, so being unable to move the left foot did not have any play in your opinion that Nurse Craddock conducted a neurovascular assessment, correct?
Objection.
Well, I mean, that comes into it. I mean, he's unable to move the foot. But the pedal pulses, in order to take pedal pulses bilaterally, you've got to touch and feel and place your hands on the patient and check their skin temperature. So that all has to be done to do pedal pulses. Obviously, he can't move his foot at this time.
Was that an abnormal finding on the neurovascular assessment?
What, that he can't move his foot?
Yes, ma'am.
No,
It's not abnormal.
no.
You said that you believe the doctor or whatever provider came into Mr. Tolson's room after the nurse left, after being informed that Mr. Tolson complained of a cold foot, he had no feeling, was aware of the complaint that he just made to the nurse, that he had a cold foot, he had no feeling. Was that your testimony?
Objection.
Objection.
Objection, I didn't follow you either.
Yeah. When the sister left, she stated in her deposition that there was a physician going into the room. Their mother was present in the room, was very well aware, and made documentation that the physician re-examined her son. If he was vocal regarding his cold foot to multiple medical providers, which is in his affidavit, I can't imagine why that wouldn't have been told to the provider directly by the patient when he came in to be re-examined, or even relayed by the nurse when she came out of doing vital signs. Because all nurses will report those types of things to a provider.
But you're aware in this case that the doctor and the physician's assistants swore under oath that no nurse ever told them that Mr. Tolson reported to them that his foot was cold, and he had no feeling, correct?
Objection.
Is that correct?
Well, I'd have to go back and reread it, but the patient said he told him.
Your
Right,
question
but the
was
doc-
based on a
the-
hypothetical,
No, the
Rodney.
doctor.
You know?
Let me ask another
Yeah.
question.
Yeah.
Did any of the nurses in their testimony testify that they told the physician's assistant or the doctor that Mr. Tolson complained of a cold foot?
No.
Objection to the hypothetical.
Yeah. And did any of the doctors testify in this case, or physician's assistant testify, that a nurse ever told them that Mr. Tolson complained of a cold foot?
Objection.
I'd have to go back and read their testimonies. I don't recall whether they did or didn't.
Well, You don't remember one way or the other?
No, I've read so many of these. I'd have to go back and look.
Okay. Did you read in Mr. Tolson's deposition testimony that right before he was going to be discharged, there was a nurse in his room and another man in his room?
I'm sorry, whose deposition?
If you want to ask her about depositions to this detail, I think you're going to need to show her the testimony you're
Well,
referencing.
you did without showing her any testimony. Let me ask you another question. Do you remember when Mr. Tolson was getting ready to be wheeled out of the room, that a man was in his room?
It was in one of those depositions, but I don't know which one.
Right. And he had complained to this gentleman that he had no feeling in his foot, and his foot was cold, correct?
Objection.
That's what is in the deposition, yes.
Right. Now, but this gentleman never conveyed his complaint to any nurse or any medical provider to your knowledge. Is that true?
Objection.
I don't know who the gentleman is, so I don't
Right.
know.
And didn't you want to know who the gentleman was that he made this complaint to?
Objection. That is completely
I don't know what to
inappropriate.
tell you, Mr. Gaston. In his deposition, he said he told everybody. But I don't know who this individual is to know whether or not he made that complaint to that person or not.
Well,
If he says he did, I guess he did, but I don't know.
and if this individual was a technician or nurse's assistant, wouldn't the standard of care require them to convey that complaint to a nurse or to a medical provider?
Objection.
It depends if they are or not.
And if they are?
Objection. There is absolutely no testimony
Yeah.
that this person exists other than the deposition testimony of the plaintiffs.
Right,
There's
his
no
sworn
information.
testimony under oath that he's there and he told him and he wheeled him out. So
There's
don't tell
no-
me there's no testimony that these
Let
ever
me
existed.
finish.
Yeah,
There
well,
is no.
You're
there
making a
is-
false statement.
There is no evidence, no information from any sort as to who this guy is. He's described who this guy is that the family members described. There is no way to identify what role of this supposed guy is that pushed the wheelchair out of the hospital. So I am not going to permit this witness to answer whether or not this guy, this phantom, as your expert referred to him, it breached the standard of care or was required under some standard of care to do anything or not do anything. That is completely inappropriate, and I am going to tell you not to answer that question.
Did you ask Ms. McGuire if she could identify the man that wheeled Mr. Tolson
Objection.
out of the hospital?
Did I ask Miss McGuire?
Yes.
No, I don't think so.
And you did read Mr. Tolson's testimony
I did.
that while he was there, the nurse was also there, the blonde woman, correct? Both of them were in the room at the same time.
Let's see the deposition testimony.
I
Just
don't
a
know. You
minute.
have to show it to me. I have to read
Okay.
it again.
Good page, I'll read it from it's
No.
on page 182. I'm doing the questioning, so
Well,
you
then,
could just hold on.
let her get to
Go
it
to-
and
go
let
to
me get
page
to it
182.
because
Mhm.
I know how you read things.
Yeah, right.
Kevin Tolson, right?
And hold on, I'm not there yet either.
Okay. Photographic memory.
Okay, what page are you going to read from?
Well, ma'am, why don't you go ahead and read page 181, 182, and 183.
To yourself.
And go to page 102.
Okay. Some guy, huh?
Right.
Wait till he asks you a question before you come.
According to the sworn testimony of Mr. Tolson, he told the individual who was getting ready to wheel him out that, hey, you know, I still feel nothing. I feel numb and I can't move my foot and it's cold. He told me, you know, that's normal, you know, you should be all right. And then he said, you've got a pulse, you'll be fine.
Where'd you go there?
183.
Okay,
Oh,
so
no.
you just skipped from an incomplete answer that you read into the record on page 102. You didn't finish reading it, nor any of the stuff around it, and then jumped to page 183 for that one little excerpt.
We said, yeah, you got a pulse, you'll be fine. Now, you're going to give opinions in this case that none of the nurses who saw or assessed Mr. Tolson breach the standard of care, correct?
Correct.
Do you know if this gentleman was a nurse or not?
I don't.
Do you know if he was a nursing assistant or not?
I have no idea.
Do you know if he was a nursing technician or not?
I have no idea.
If he was either a nurse, a nursing assistant, or a nursing technician, assuming that Mr. Tolson testified truthfully and told him, quote, I still feel nothing, I'm numb, I can't move my foot and it's cold, well, that person has the same obligation that you testified before about the nurses to bring that complaint to the attention of a medical provider.
Objection for the same reasons that I put on the record a few minutes ago, and I'm telling you not to answer that question.
Okay. So I'm not going to answer that question.
You refuse to answer my question?
Yes, sir.
She's refusing to answer your question.
Thank you. If that person did not convey Mr. Tolson's complaints that his foot was numb, he can't move his foot, and it's cold, to either a nurse, a physician's assistant, or a medical doctor, would that person have breached the standard of care?
I'm objecting again for the same reasons. This is an unidentified person for whom you have no information regarding who he is,
It's because
or
the
what he
hospital
is.
won't tell us who he is, that's why.
And that's absolutely incorrect, and you know that's incorrect,
No.
Mr. Gaston.
It's
You are again
not been
misrepresenting.
identified at all.
So I'm instructing you not to answer that question because you can't answer that one either, because you have no information for even the prior one.
Yes. You're right.
So are you refusing to answer the
Yes,
question?
sir.
Okay, thank you. All right, that's all I have.
Unfortunately, ma'am, I'm so sorry. All of these questions from Mr. Gaston and from me regarding this testimony regarding the cold foot, I can't feel my foot. Those were all presented to you as a hypothetical, is that correct?
Correct.
Okay. And that's because the actual testimony in the case from the healthcare providers and the actual medical records in the case from all the various healthcare providers all established that, in fact, Mr. Tolson did not make a complaint of a cold foot to them, correct?
Objection.
And am I correct that all of the medical records in this case, from no matter who it was that made the entry, and all of the deposition testimony of the providers also is that Mr. Tolson never complained that he could not feel his foot to anybody at any time in the course of his stay at the ED on December 3, 2009, correct?
Objection.
Okay. And therefore, when Mr. Gaston asked you if Ms. Shaw or Dr. Jackson said that a nurse told them that Mr. Tolson had a cold foot, under their medical records and their memory of this case, they wouldn't expect that to have happened because they themselves assessed his foot and he did not have a cold foot, correct?
Objection.
Correct.
And similarly, when Ms. Stell was asked whether or not she reported, or whether or not Mr. Tolson, rather, reported to her that he had a cold left foot or couldn't feel his left foot, am I correct that Nurse Stell testified that he did not because of the way she documented the record? She knew that he had not made those complaints to her.
Correct.
Okay. That's all my questions. Thank you.
I have another question for you. In reaching your conclusions that the nurses didn't breach the standard of care in this case, are you assuming that Mr. Tolson never told a nurse who was caring for him that his foot was cold and he had no feeling in his foot?
Objection. You've asked her an entire day of deposition questions
That's the-
where she's
please-
testified
please
to what
don't-
she relied on.
Are
Say
you-
it again.
Yeah. In reaching your opinions that the nurses who cared for Mr. Tolson did not breach the standard of care, are you assuming that Mr. Tolson did not tell any of those nurses that his foot was cold and he had no feeling in his foot?
Objection.
I can't assume anything because the patient, your client is saying that he did. Okay. But whether he had a cold foot, their only obligation was to report it to the physician.
She already testified to this.
There's nothing they can do about it as a nurse, other than report it to the provider. That's
Thank you.
all we can do.
Thank you.
And you've already testified, I believe, Ms. Carlson, as to the taking his client's testimony into account, which I believe that you did for your
Yes,
testimony,
yes.
correct? In taking their testimony into account, you've already testified as to whether or not, even under their account, that there was a physician who was aware and assessed Mr. Tolson's leg at the time of these alleged complaints.
Yes.
correct?
Objection. Calls for speculation again.
Thank you.
Okay.
That's it. We will read and sign.
Thank you.
All that is that you get to read one of these booklets
My own.
of your own testimony.
Wonderful.
Yeah, I know. I'm
Ms.
sure
Crowe?
you're delighted by that idea.
This,
Oh,
That's
sorry.
yours.
We need to
this
close up.
deposition is concluded, 6:25 PM, going off the record.